And I'm delighted to be joined by two people who are living with diabetes. We've got Chantelle and Geoff. So first of all, I'm going to ask Chantelle to briefly introduce herself.
Hi, I'm Chantelle. I'm living with type 1 diabetes for the past, 23 years.
You don't look it, Chantelle. So thanks, Chantelle. And we'll hear from Geoff in a little while because I'm going to focus on you, Chantelle, if you don't mind.
Okay.
So just to say that in this segment, we can't do justice to your 23 years living with type 1 diabetes. But briefly, we want to share some of your insights, some of your experience, some of your expertise, so that can help other people who are living with this condition. So,
Yeah.
Chantelle, if I'm working, when I've got my healthcare professional hat on, I'm sitting there, the next person is going to be Chantelle. I've seen blood test results for Chantelle. Chantelle's coming in and I'm saying to Chantelle, this is the diagnosis. How was that for you, Chantelle?
It was shocking, I must admit. I was only 9 when I was diagnosed. And to be honest, I had seen and known about diabetes through my mother and my grandmother. I'd watched my mum take insulin, I'd watched my grandmother, they both tested their sugar levels. Ever since I was young, my mum tested my sugar levels, just to check because she knew my grandmother and her both had it. Just wanted to make sure that, it hadn't passed down to me. Then one morning I just kind of woke up and my mouth was very, very dry. I told my mum, she took me straight to the hospital and I was diagnosed.
And, Chantelle, I think we should also just acknowledge here that this sharing of insights can be quite triggering, quite traumatic, and quite difficult for some people. So thank you for acknowledging and highlighting how shocking it can feel, how difficult it can feel, how traumatic it can feel for you as an individual, you as a child, but also for your family as well. And you highlighted some really important aspects there because you said about the family history.
Yeah.
So there was a certain awareness within your family that you've shared with us.
Yes, there was.
And also in terms of the symptoms. So it was that severe thirst.
Yeah.
You as a child experienced. And we know for children it can be very dramatic in terms of what we call symptoms, but what you would have as feelings.
Mm-hmm.
Yeah. So when you had this shocking news, even though your family had this awareness of it, how did you and your family react? How were things going forwards? Because we've said, as the title for this event, Black diagnosed with diabetes. What next? What was next for you and your family?
The first thing my mum did was cry. She really didn't want me to have diabetes. The first thing that happened was I got put onto a ward straight away, onto a children's ward straight away, and I was seen by doctors and nurses and had tests done, and it was very overwhelming. As a child, it's extremely overwhelming seeing like so many different people. I got introduced to a diabetic nurse. Fortunately for me, she was also Black, so I felt a bit more comfortable. Like she was explaining a lot to me about, in a way, kind of being Black and having diabetes, and I was always asking what the cause was, and nobody really knew. So it was very overwhelming to just be like told, this is what you have, this is what you have to do, and I just wasn't sure.
Chanel, did you feel that you had enough information in order to enable you to change your dose of insulin, perhaps change your timing of insulin? Did you feel that you had sufficient information?
From doctors, no. The first nurse I had, she was pretty good. She was very helpful in terms of talking to me about dosage changes. I ended up with a black doctor. The main insight I got was I did not know about ketoacidosis, and that's what she told me about. And there were so many things I didn't know until I had the black doctor. I had never seen a dietitian. I didn't even know I was able to see a dietitian because I found that for some reason with the insulin, I'd been gaining weight, and it really got me down because as a teenager, you don't want to be gaining weight. And I learned how to eat better, how to eat healthier. So it was just enlightening, like on different things about the foods that we eat because they're not the same as other people. And I got to learn about the glycemic index.
So, I mean, I often say that food is fundamental to diabetes because it all starts with that, doesn't it? So,
Yeah.
you're saying I hear that the Black healthcare professionals were able to give you more specific advice to your culture. So then had the knowledge that you needed to adjust things to suit you and improve your diabetes.
Yeah, that's correct.
Yeah. Okay. So, I mean, in terms of food, it's so important that that is culturally specific because even as Black people, we're not the same. You know, some of us originate more directly from Africa, some of us originate from the Caribbean, some of us originate from South America, have different culture, different experience, different understanding. So it's really important that we are quite specific in the advice that we give. So you had that knowledge, which you gained from your journey at different times with different healthcare professionals. What's your experience of, let's say now, that's the healthcare system? What about your family? Did you have any particular challenges in dealing with your family and living with type 1 diabetes?
Specifically for me, I didn't have any challenges. Like I said, my mother and my grandmother were both diabetic. I mean, to be honest, my dad didn't really understand as much. It was a lot of me finding out information and trying to teach him. And so it was more difficult with him, and I mean, friends didn't really understand either. So it was quite difficult during school. I mean, I remember when I was going through a quite rebellious stage, I had a friend who understood a bit about diabetes, and she saw me just drinking like lots of fizzy drinks and Lucozade and everything. And she actually went and told my mom. And it actually quite shocked me that someone cared that much about, me, to take notice of what I was actually doing, and someone who actually understood what was going on.
So she remained your friend.
Yes. Yes.
And what advice would you give for, let's say, sometimes it's parents or a person themselves who's living with type 1 diabetes? What sort of advice would you give them? Because you've got 23 years expert knowledge, the highs, the lows, the best way to manage things for you as an individual. What sort of advice would you give to either parents or that young person living with type 1 diabetes?
The advice I would give to a young person living with type 1 diabetes would be to really take care of yourself. Take your insulin, make sure you know what your sugar levels are. Make sure you know for yourself like what your own range is in terms of your sugar levels, because it's not the same for everybody. Having high sugar levels, it's not good. With all the complications that you can get, all the complications that can happen. I mean, I've had a fair few complications myself, so it's just not worth it. It's really not worth it. And parents who have teenagers, especially, really need to watch what their children are doing. I mean, not too closely, give them a bit of freedom, but really take notice and take like notice of what their child is doing.
So, Chanel, that is so insightful. And, we are about experts and about experts' advice.
Yeah.
And it's been great what you've been able to share with us. I'm going to now move to Geoff as a person living with type 2 diabetes. So, Geoff, it's fantastic that you're able to join us here as an expert person. Do you want to just briefly introduce yourself, please?
Hi, my name is Geoff Schumann. By profession, I'm a British school teacher. I'm a humanities trained teacher. But at university, I was always a troublemaker and I liked the gift of comedy. So I left teaching to pursue a career in comedy and broadcasting. And I still find myself 30 years later doing that. When I have diabetes in my family. My mother, when she gave birth to me in the 60s, she herself became diabetic, with me being the last child. I was very much in denial. Didn't go in those days in the 80s, early 90s, didn't go for any tests. The only tests I know black people went for were examinations of a sickle cell. Diabetes wasn't something that you were tested for, not in my GP anyway. Rather embarrassingly, I became diabetic about 25 years ago whilst broadcasting on air. I collapsed. And I still was in denial, still eating the wrong things, not taking care of myself, until it became extremely serious. And sometimes my sugar levels would be up to 30. The meter couldn't read, through misbehaviour and the kind of profession I have and the poor foods. But I've managed to control it. I'm better now than I've ever been. I also came into contact with Grace a few years back, and I hadn't seen a healthcare professional. And this is coming from my own perspective, so senior, and was able to speak with me in a way and really gave me a friendly, sisterly telling off about diabetes complications. I'd known of them before, whether one pays attention. And then Grace kind of took me under her wing, and I'm dealing with healthcare professionals culturally who are fantastic with me. The telephone calls that I get, the things I talk about, the diet, the food, the reminiscing, it's just wonderful. I am a type 2, but when I have been naughty, my pancreas does occasionally spew out insulin. I do take a shot of insulin, 12 units and 8 units, but my levels have been very good. Sometimes I'm not taking insulin, and after food, my levels have been 8 and 9 after eating. So I'm managing to maintain myself. So sometimes I don't take my insulin, but I know that I should do. I have a blood pressure tablet that I take, but I'm training a lot more. I really should never have let myself get into the condition. But again, it's about a mindset. It's about being in denial. And now I understand it much better. I could have done a lot better 25 years ago, in truth.
Geoff, what would you have told your 25 years ago self, knowing what you know now? What would you have said to yourself? What advice would you have given yourself?
I to do better and to listen to the healthcare professionals. Diabetes claimed to my brother 11 years ago, who was a county squash player. He got liver failure. And so I could even see then when he had amputations, I still wasn't listening. I still wasn't paying attention the way I really ought to. And I think that I would tell myself, eat better, live better, do better.
I'm really sorry and to hear about your experiences, Chanel's experiences, your brother's experiences living with diabetes. And the whole point is we want to prevent that if we can for other people. And so you as an expert, a person living with type 2 diabetes has given some advice: live better, eat better, be better. What can we as healthcare professionals, what would you want us to do?
Can I openly say, can I really emphasize, I really can't emphasize how good it's been for me as an individual, being in the care of Grace. I really can't. I have someone who looks like me. I have someone that I can speak to sensitively. I would never speak to a white healthcare professional in that manner because the language, sometimes I slip into patois and make Grace laugh. I have a nurse called Adama, who's of West African extraction, who I can say things to, talk with, talk about the foods that we eat. And it's in such a manner and a way that, I'll get phone calls when they don't necessarily have to check up on me. And I'm boasting about, oh, my level 6.4, 4.1, I had a hypo. I'd never had a hypo until I came into contact with Grace's team because I started to do things properly. I was never under 14 or 15. I test myself 3 times a day. I'm only told to test myself twice. Sometimes I test myself 4 times a day because I can't believe the readings. When I see 5.1, 6.2, 8 after food, I almost want to go out and celebrate and become Usain Bolt. I'm so happy that, I will disturb Grace with a text by saying, Grace, do you know what? I'm not sure if the meters are working. I'm 8 after food, 4.5, 5 points, and sometimes I don't even take my metformin because the readings are good.
I think that shared culture is so important because, okay, so you may not have the shared culture, but if you can have the cultural sensitivity,
Yes.
if you can know where to look for the information, because I have dealt with people from all over the world. I've had that privilege. And what I've had to do sometimes is look for the information that's pertinent, that's important to that person in front of me, not try and just give information the same way to everybody because everybody's very different. So I know both of those excellent people you're talking about, Geoff, and I know that they can tailor the message and the information depending on who's in front of them. So they give that excellent service to all the people that they see. So
Yeah, I'm testament to that. And the great thing about it being tailored, I have to say healthcare professionals have been very good with me, but both black and white, in terms of telling me what to do. But it was once I came into contact with Grace in particular, sort of 6 or 7 years ago, it was that kind of, well, look at your family, look at your brother, look at what it's doing to you. And then you start to hear about the alarming rates in our communities in both Africa and the Caribbean. And it really was having that somebody to speak with me and then said, okay, I'm going to get one of my specialist team to deal with you. And Ealing has a very, very good system. It's called DICE, Diabetes Integrated Care System Exchange, DICE. And they're very good from the podiatry, but the nutrition advice and the checking up of one, I think is absolutely. I mean, I'm doing this because I'm really hoping that, one, because of profile, and two, that I was in so much denial, doctor, that I caused the complications. And if by speaking to, I had a very fantastic session with Bernadette a few weeks back, by speaking to somebody who understands, and you're able to say these cultural sensibilities without feeling, well, are they going to understand when I say certain things? Are they going to be able to attain what I'm attempting to say? And I just feel so free when I'm talking to an African Caribbean healthcare professional. That's just how I personally feel. I'm able to say things, talk about types of food, talk about the denials. I feel extremely comfortable in the same way in which women feel comfortable with female doctors. I totally get it. I really, really do get it.
and as I said to Chanel, food is fundamental to diabetes, really, isn't it? So, Geoff, one of the things I wanted to ask you, because food is very fundamental to type 2 diabetes as well. Have you had any challenges, difficulties, let's say, with family? And, you know, if you've tried to change things.
Well, family know. We lost our brother. I've got two other sisters who are diabetic. Well, one's borderline. So we know it's in the family from my mother. My father never had it. But so it's hereditary. But for me, it's really psychological, because if I'm somewhere and I'm in agreement, I was at Television Centre recently, and there's a whole tray of fruit. Yeah, a tray came round with jam tarts and sugary drinks. I thought I did well by avoiding the sweet sugary drinks. Now, even water was the best thing for me rather than having a Diet Coke. But something told me you want that. You know, if somebody had told me, doctor, what I was once told, that sugar is as addictive as cocaine, I would have then paid more attention. Things trigger where I want sugar, I want chocolate, I want sweet things. I'm so much better now. I'll reach for a banana, or I'll have a tangerine. I'll have Quaker Oat, things that are slow release. But I'm so happy when I read, doctor, I'm on 3.9. I can't wait to grab a chocolate bar. I can't wait to have that sweet trigger to bring my level up. If I were female, my female friends often say they crave sweet things when they're on their menstrual cycle. Then I must constantly be on my cycle, because I'm always wanting sweet things. Always.
On that note,
Disease.
What I want to do, Geoff and Chantelle, is thank you both so much.
Thank you.
You are the experts of people living with type 1 and type 2 diabetes. As Black people, you've stepped forward and you've shared your insights, your experiences, the challenges you've had living with this condition, how important it is and has been to you both and your families, how important it is for us as a community because it's so prevalent, and some great advice about things that we can do. Is there one last thing you want to share with us?
No.
To Chantelle first.
No, so I've got to go. So just a very quick one. Doctor, thank you. Bernadette, thank you. Chantelle, we'll catch up soon. Hopefully we can have a laugh and not too much sugar when we next see each other. But this is just wonderful. I really cannot. My conversation with Bernadette a couple of weeks ago, and to Grace and her team, for me it's revolutionary, and hopefully it will add more years to my life.
So thank you so much, and to other people's as well. Really, thank you for your help. Thank you. So Chantelle, any one thing that you would like to add?
No, not really. I mean, Geoff did say that it's hereditary in his family, but it is not always hereditary, because I have been tested for the genetic mutation for it being hereditary. It just happens to be in my family for some reason.
And that's a really important point to raise. Thanks, Chantelle. And I think being positive and going forwards, the other thing is that you've both been able to feel healthier living with this condition. And despite the shock of getting that diagnosis, being able to move to a place where it's alongside you and not overwhelming. So thanks so much. Really appreciate it.